Hi there, Taylor.
Oh,
Hey, good to see you again
You
here.
too.
Thank you very much for meeting with me today
Sure.
and getting a chance to kind of go over how things have been going for you. If
Absolutely.
you want to go ahead and have a seat there. All right, so how have things been going so far for you?
well, I've been very blessed. I feel like I've got a great team to work for. A lot of, folks have been willing to step in and help out whenever I've asked. Been some, we've got some bumps in the road, just like any, new position and things we're working on to improve. But overall, I feel like we're on the right direction.
All right, great. Well, that's wonderful to hear. Is there anything that I can do from my standpoint, or that the organization could do to kind of help you to make things easier for you?
Well, I feel like the times that I've needed, assistance from your area, you've been quick to respond, and I appreciate that. But I feel like the resources I've been given have been adequate, and moving forward, I'm sure if I do need you, you're just a phone call away. So I appreciate that readiness and availability to help out when needed.
Okay, great. Well, that's wonderful to hear, and I thank you for the compliments there. So as far as today's meeting, basically, today's just a quarterly performance review meeting. It's just a standard meeting that we have with all the employees, every quarter, just to kind of see how things are going. And as part of that regular process, we're always trying to not only highlight the things that are going well, but also trying to identify a couple of areas that we can work on to improve, to make things work even better for you, and make things work even better for the organization as well. Starting off, just wanted to first of all let you know that as far as like employee satisfaction, the employee surveys, your scores have been wonderful. The employees just really seem to connect well with you. They've been very happy with your leadership. They can already see the positive changes that you're making, and they've just been very happy. Other things, doing our weekly leadership rounds, just observing you with customers and patients, out in the lobby and hallways. It just seems like you have a wonderful rapport with the patients and customers. And healthcare is a stressful thing, and we all know things can be kind of unpredictable at times, and it's just wonderful to see when that emergency CAT scan comes in and everything else kind of gets sidelined, your ability to go in there and just kind of explain the complex situation to the patients, help them understand why things kind of got derailed there momentarily, and then if things need to be rescheduled, being able to help them out with that process. That just really goes a long way to keeping the patients happy and keeping them coming back to our facility. So, again, just greatly appreciate your efforts from that standpoint.
Thank you.
As far as a couple of areas, that the leadership team identified that we would like to continue working on with the radiology department. First thing would be safety issues, and this, of course, was something that was an issue long before you came. And it's just something that we wanted to continue, focusing on, and just something we'd like to continue to see more improvement.
Sure.
Do you have any thoughts on that?
Well, safety is one of my highest priorities, in this position, keeping patients safe as well as our staff. And, it's like you said, it was something that's been ongoing. I feel we're taking some steps in the right direction, but what I'd like to see more of is getting some of my staff involved, getting their input, maybe some ideas, doing some brainstorming as what we can do, what kind of resources we have available to us in the department to help get us going then, even a better direction than where we are right now.
Okay, yeah, I think that's a wonderful idea. And, a lot of the times, some of the solutions to problems are already out there.
Right.
Some of the employees, they already know what the solution to the problem is, or they have great ideas working towards a solution. So I think getting them involved and, maybe kind of a blue ribbon committee sort of situation is a wonderful idea. So I really like that idea. Moving on to the next topic as far as areas of improvement. One thing I did notice on one of our weekly leadership rounds, there was a situation where it looked like maybe one of the employees, something wasn't going well for the employee that day, and it appeared that some sort of disciplinary action was, going on kind of out in a public hallway there. I don't know if you remember that, or.
I can't say that I do, but, and if I, approach them with an earshot, that's definitely not something I would want to happen. I know things happen and we need to address them, appropriately. And, if I'm in situations where I thought we were not within earshot of anybody, and, unfortunately I've been in situations where I did not notice there was someone nearby. So something that I, along with safety, is making sure that the private matters stay private too. So I'll, continue to make sure that if there's something that needs to be addressed, it's in either an office room or another area where there's no other individuals within earshot to discuss that. So
okay, great. Yeah, and that's certainly understandable, and sometimes things kind of happen in the heat of the moment, and just taking that moment to slow down and kind of set aside another time to go through things.
Right.
So yeah, from that standpoint, I like what I'm hearing. It sounds like you've got some good plans in the works. Any help or assistance that you think you need from me? Anything I can do to help you in that regard?
Well, not at this time. Like I said, I know you're just a phone call away, and like I said, you've been great to respond in my other previous needs. So when we get to that point in the bridge where I need extra assistance, I'll definitely be giving you a call. Appreciate that.
Okay, great. And a couple of suggestions I might make that might be helpful. If you want to maybe put together kind of an action plan for each one of those issues, kind of write them out and then maybe drop them by my office later in the week.
Okay.
I can go through them, give you some suggestions, and then maybe we could meet in a couple of weeks to kind of go over how the plans are going, and
that sounds good.
Kind of go from there. So
okay,
all right, great. Well, that sounds wonderful. Kind of wrapping things up here. Just kind of wanted to go through the official performance review form. Most of the stuff here we've actually already discussed. Here's actually the front page here.
Okay.
So you can see, the results of your self-evaluation. I think you kind of underestimate yourself a little bit in some of these, categories. I just want to reassure you're doing a wonderful job.
Thank you.
And I think you kind of identified some of the, same areas that need improvement that I did. So I think that's wonderful as well.
Okay.
And feel free to go through some of my comments here.
Okay.
Basically, the same stuff that I just discussed with you
Okay.
now. And then also, if you have any comments or feedback that you would like to record for the record, you're certainly welcome to record that. Otherwise, I just need you to sign here, and then I'll sign here and kind of go from there. So,
Okay.
all right.
Sounds great.
All right. Here's a pen for you.
I'm just gonna look this over here. I think that looks. I think that's. Okay, so, and will I be getting a copy of this back for my records?
Yep, certainly. Yep. As soon as we leave here, we'll go ahead and get you a copy.
Okay,
So.
that would be great.
All right. All right. If you want to head this way, we'll just
Okay.
head out and get a copy here.
Sounds great.
All right. Thanks again for
No
being
problem.
with me. Greatly
No problem.
appreciate it.